So I know that you usually throw away your drugs, your the drugs they give you during antenatal pains. Yes, I caught you there. So I am Adesu Aboni, the step-up and in this video I want to enlighten you on the importance of taking your hematinics, right? Your prenatal vitamins, they mean the same thing now during pregnancy, right? Now, lots of people, both learned and unlearned, literate and illiterate, rich and poor, which other category can I use? All levels of people, different extremes of people have issues with taking their medications. And yes, are people mental health professionals, nurses and doctors that also have issues with taking their medications, right? Now, I for one, I don't like drugs, right? I have 2 children, but I make sure that during pregnancy I did everything possible to take my prenatal vitamins. You see that one they are calling vitamin B or folic acid. Those two have very annoying smells that can make you feel like even throwing up. You are trying as a pregnant woman not to throw up, and one drug is coming to make you feel like throwing up. I understand. So that is why I went through the process of explaining to you that I'm also going through pregnancy and I know what it feels like. So I am not here to tell you something that I've not gone through. You not say, oh, this nurse, she's just blabbing, she's just talking. You don't know what it feels like to carry a 9 month pregnancy taking those stupid vitamins. No, you have to take these vitamins because they are very important. Right now, some people feel fatigued, they feel tired in pregnancy, like they feel like they cannot carry themselves. Some people feel dizzy. When you are feeling dizzy and you are feeling fatigued, it's because there is a deficiency somewhere, nutritional deficiencies, right? So now these prenatal vitamins help to block, help to assist, help to give the extra nourishment aside the food that you eat. Even if you eat balanced diet, you know, some people say, oh, eat balanced diet. Yes, it helps, it goes a long way. And trust me, sometimes if you take balanced diet, you may not need those prenatal vitamins. But please don't take my words for it. Always add the additional. Okay, let's use this example. If you have $1 million in your account and somebody says, oh, I want to give you $1 million, will you say, okay, I have $1 million, I don't need your $1 million? You should just please add to what you're going to have to prevent unintended eventualities, right? Because what if your PCV was 32% and you got to the delivery table and you lost blood so much that you lost 4%? It means that they will have to give you a transition. But if you're taking your prenatal vitamins and you have PCV of close to 40 or about 39%, even if you lost so much blood, you will not crash below 30% and you will not need a blood transfusion. So that's one good reason why you should use your prenatal vitamins. And like I said before, in terms of prevent all these dizziness, flashes, like you're feeling fatigued, you want to fall down and all of that, right? Now, these prenatal vitamins are very important. Take for example, you see the red one that's called ferrous sulfate, right? Some people call it fesolate. I already used to calling it fesolate in this part of the world where I live, right? That red one is very important because everybody in their blood has something called red blood cells. Now, these red blood cells make your blood have that color red. But red blood cells are not the only cells you have in your body. You have white blood cells, you have platelets, right? So now red blood cells, like I said, make your blood red. And these red blood cells carry oxygen. And now these red blood cells move like blood moves through the placenta into your baby's body, right? So if you don't have enough, it means that you have reduced flow of blood to your baby and you have reduced flow of oxygen to your baby. So it will only do you well if you take your folic. Now, folic acid helps to prevent neural tube defects. Now, that sounds like big grammar, but have you heard or have you seen babies that look abnormal, like they don't have head? And encephaly, like the heads absent, right? And have you seen babies that have big heads? And have you seen babies that have spinal bifida, right? Spinal bifida is a kind of neural tube defect, and it's a situation whereby the spinal cord transmission, like the continuation of spinal cord is truncated along the line, and then the meninges will not flow out, or the contents that's supposed to be inside your bone, inside your backbone, now come outside and it forms a sac behind the baby's back. It's very crazy and it has no cure. You can just keep managing the baby and doing, patching up, but it cannot be cured. So it's better to prevent such. And now, That is something that folic acid does for you. Now, the folic acid that can help to prevent neural tube defects, or that can help to prevent these issues, are the ones you have taken before you even got pregnant, right? So if you got pregnant and you are not using your folic acid, if you started using your folic acid a month, 2 months into pregnancy is good, but if you started using folic acid 3 months after, you just wasted all the folic acid. Okay, well, you didn't really waste it, but it will not help in the sense that it will not help to prevent that neural tube defect I talked about. So now the folic acid you have taken before you got married and the folic acid you have taken before the first 3 months of life is what will help your baby to prevent that neural tube defect, right? That spinal bifida and all those other things I mentioned. So if you are getting married today, please start using folic acid right away. Don't wait till you start vomiting or you start falling down, right? And if you are planning to get married next year, you can as well start taking folic acid right now, right? So don't wait till until I'm pregnant. And even if you're not getting pregnant, folic acid is still good for you. So any way you look at it, it's a win-win. Now we'll go to vitamin B co. Vitamin B co is a combination of different vitamins, up to, is it 6, 7, 8? I think 8, yes. Vitamin B1, B2, B3, B5, B6, B7, B9, B12. All of them have special names: thiamine, niacin, thiolacobalamin. But you don't need all those big grammars. All I just want you to know that when you look at vitamin B co, you are looking at 8 different vitamins in one single tablet. So just thinking about that, it should be enough reason why you should not look away at that drug and throw it in the toilet. Yes, some of you pour it in the toilet and flush it. Some of you will pour it on the main road. As you are leaving the hospital, we just see it on the main road, they flung it out. Even anti-malaria, you could do that. Some of you use anti-malaria first and second dose and you throw away the rest. Well done, I caught you there. Please do well to use your medications. And like I've said before in previous videos that I've made in the past, if you cannot use it with water, use it with tea. If you cannot use it with tea, use it with Coke, use it with something. But I'm not asking you to be a Coca-Cola drinker. But please do everything possible to make sure that these prenatal vitamins get into your body. See you next time. Once again, I am Alicia. Step up.